Good morning, everyone. My name is Amy Baker. I'm the Director General of Health and Nutrition at Global Affairs Canada. First, I would like to acknowledge that we're on the unceded territory of the Algonquin peoples this morning. And of course, also today, flags are at half-mast because we are remembering the Polytechnique massacre. J'aimerais d'abord féliciter Dr. Natalia Kanem pour sa nomination à titre de directrice exécutive du Fonds des Nations Unies pour la population. Le Canada est fier de son partenariat de longue date avec les fonds. Dans le cadre de notre collaboration qui dure depuis près de 50 ans dans le domaine du développement et de l'aide humanitaire, nous nous attaquons à des problèmes de taille comme les mariages d'enfants précoces et forcés, et nous nous assurons que les femmes, les enfants et les jeunes des populations les plus pauvres et vulnérables bénéficient de soins de santé. Nous sommes convaincus que, grâce à le leadership de Dr. Kanem, le Canada et les Fonds des Nations Unies pour la population vont continuer de collaborer et d'innover afin d'atteindre leur but commun, qui consiste entre autres à protéger la santé sexuelle et reproductive des femmes et des filles, ainsi que le droit de connect. Nous sommes heureux que le rapport État de la population mondiale de cette année attire l'attention sur les inégalités. Le Canada reconnaît la nature complexe des inégalités et l'importance de se pencher sur les multiples facettes de cette question pour aider les femmes et les filles à exercer leurs droits, à réaliser leurs ambitions et à vivre en égal des hommes et des garçons. This is the heart of Canada's feminist international assistance policy. We believe that advancing gender equality and the empowerment of all women and girls is the most effective way to eliminate poverty, create lasting peace, and achieve sustainable development. And giving women and girls control over their own bodies is a critical starting point. This is why Canada announced $650 million over 3 years in support of sexual and reproductive health and rights. As part of this commitment, 19 new projects were announced at the Family Planning Summit in the United Kingdom last year, totaling $241.5 million. Canada is also playing a leadership role in the Family Planning 2020 movement to enable 120 million more women and girls to use contraceptives by 2020. And the Ouagadougou Partnership focused on expanding the use of contraceptives in Francophone West Africa. We know that while access to sexual and reproductive health and rights is critical, it is not sufficient. Globally, women and girls face many kinds of barriers that limit their potential. Recognition of the multiple dimensions of inequality is a key strength of the UNFPA report. It puts women and girls at the center of an approach founded on equality, inclusiveness, and universal enjoyment of rights. Canada's Feminist International Assistance Policy takes a similar approach, one that is human rights-based and inclusive, an approach that recognizes and protects the human rights of the most marginalized, including Indigenous women and the LGBTQI community, one that prioritizes human dignity, including access to health, nutrition, education, and humanitarian interventions for the most vulnerable. Our approach is also founded on supporting women's economic opportunities, helping poor and marginalized women to realize their economic rights and freedoms, strengthening their economic leadership through efforts such as regulatory and policy reform to allow for women's effective participation in their local economies. Together with the UNFPA and Action Canada and other key stakeholders, Canada will continue working at the intersection of these critical issues to meet the ambition of the Sustainable Development Goals and create a future where women and girls everywhere are empowered and in charge of their own health, their own livelihoods, and their own future. Now it is my pleasure to introduce the Executive Director of the UNFPA, Dr. Natalia Kanem.
Thank you so much, Amy. Thank you. Good morning. Bonjour. It is my pleasure to be with you today on my first official visit to Canada as the new Executive Director of UNFPA, appointed in October. UNFPA, the United Nations Population Fund, is the United Nations Reproductive Health and Rights Agency, and I am personally very deeply committed to realizing the UNFPA vision. It's of a world where every pregnancy is wanted, where every childbirth is safe, and every young person's potential is fulfilled. As Executive Director, I am focusing on UNFPA's 3 transformative zero goals for our new strategic planning period, which starts next year in January. The zero goals are by the year 2030, which will be the culmination of the Sustainable Development Goals era, 0 maternal deaths, 0 unintended pregnancies by meeting the demand for family planning, and 0 gender-based violence and harmful practices such as child marriage and female genital mutilation. We join with Canada today on the sorrowful commemoration of the gender-based violence which led to the deaths at the Polytechnic Institute so many years ago. During this visit, I also would like to make it clear that UNFPA is using Canadian financial support to lead with a purpose to help some of the most vulnerable women and girls on the planet, whether it's Africa, Asia, Latin America, Europe, or the Pacific region. We are grateful to Canada for stepping up to bridge the over $30 million gap that was left by the defunding of our humanitarian work earlier this year. It has meant a lot in places like Syria and Iraq. In my visit to Jordan, to our team there last month, I met with Syrian refugees in the Zaatari camp, one of the largest on the face of the earth. And there I met with young people, young Syrians who have renewed hope and a renewed belief in the future and a renewed belief in peace and social justice, due in great part to Canada's support to UNFPA. Canada is the top donor to our humanitarian work, allows us to serve pregnant women who are fleeing from conflict, young people who need a sense of purpose even in the chaos of having to be in a fragile context. And Canada continues to be one of our main core support donors through 2017. So we sincerely thank the people of Canada and the government of Canada for ensuring that we're able to continue life-saving work even in very fragile contexts. Today, I'm happy to be back in Ottawa to launch Worlds Apart. This is the State of World Population Report for 2017, and it highlights how inequality in women's health can lead to the reinforcement of economic inequality and impede the economic growth and development of countries. The report is path-breaking, and it gives a warning. We are warning about the potential cost of inequalities in society and in the world, and in particular, the overlooked inequalities which have to do with the fate of the adolescent girl and women in poor societies. And we say, and the evidence demonstrates, that there is a correlation between thwarted development efforts and failure to achieve the United Nations Sustainable Development Goals, particularly the first goal, which is to end poverty. There is also a correlation between political extremism and unrest and the fate of the adolescent girl. The report is innovative. It moves beyond the standard economic measures to show that beyond wealth and income, there are implications of gender that have to do with sexual and reproductive health. And these inequalities mean that there will be a blockage in our ability to attain the goals. Reproductive health inequality reinforces and is reinforced by societal inequality, whether social, racial, political, or institutional. When women are able to control their fertility, they can finish their education. They can regain an advantage in the labor force and more economic power, which benefits not only them, but it's been proven time and again, their families and the generation that succeeds them. The report calls for heeding the Sustainable Development Goals aim to reach those furthest behind first. And in fact, Canada does dare to go where others are not treading. And this may mean a mountain community, an island community, or even in the midst of plenty, the report shows there is inequality within countries. And we need to look at this in terms of realizing shared prosperity. Prioritizing the adolescent girl, making sure that she does not fall victim to child marriage, making sure that she has vital life-saving information about pregnancy, protecting herself from coerced sexual activity, and also protecting herself from sexually transmitted infections, allowing her to fulfill her potential so she contributes to the demographic dividend through governments taking actions such as investing in education and delaying childbirth. This means that future generations will benefit. UNFPA is here to help tear down the barriers that stand in the way of this adolescent girl achieving her potential, whether that is a discriminatory norm, a cultural practice, or a service gap. So we aim to have zero maternal deaths, zero unmet need for family planning, and certainly an end to gender-based violence. I would like to close by reiterating my sincere thanks on behalf of UNFPA and the 155 program countries where we serve to Canada for your financial support and also for your leadership support. Leadership matters, and it counts now more than ever. When Canada raises its influential voice on the world stage, others listen, and it gives courage to the adolescent girl who is bereft without the help and the generosity of the people in the government of Canada. So thank you for leaving no one behind. Thank you very much.
Good morning, everyone. I'm Sandeep Prasad. I'm the Executive Director of Action Canada for Sexual Health and Rights. On behalf of Action Canada for Sexual Health and Rights, it is a pleasure to welcome Dr. Natalia Kanem to Ottawa on her visit here as the newly appointed Executive Director of the United Nations Population Fund. Her visit is especially important today, the National Day of Remembrance and Action on Violence Against Women in Canada, as we acknowledge the reality that we live in and the work that still remains to be done to ensure that all people, including women and transgender people, live in a world free from violence. As UNFPA's implementing partner in Canada, Action Canada has had a close and long-standing relationship for nearly 20 years with this key UN agency that works to advance sexual and reproductive health and rights throughout the world. Dr. Kanem's visit to Ottawa so soon after her appointment as leader of UNFPA is a sign of the importance of Canada's work in this field. Over the last year, the Government of Canada has taken a number of decisive steps, joining actors like UNFPA and Action Canada in championing sexual and reproductive rights globally. This leadership is becoming more and more crucial in the face of a challenging global context. We are witnessing a historic attack on women's reproductive health and rights in the US, the once leading global donor on reproductive health, and the retreat of some European countries away from these issues. Canadian leadership is needed now more than ever. We need governments like Canada to step up and lead by example. At Action Canada, we've been encouraged to see this leadership emerging through the Feminist International Assistance Policy and through helping to fill the funding gap left by the US Global Gag Rule. As we watch this Canadian investment of new resources for global sexual and reproductive health and rights roll out, we need to ensure that funding is tackling key issues that are largely underfunded in the world, including contraception and family planning, advocacy for sexual and reproductive health and rights, safe abortion care, and addressing youth and adolescent sexual and reproductive health and rights. Support for these issues is critical to achieving gender equality. Canada's investment in these areas also needs to prioritize addressing inequalities and supporting the most marginalized people in societies. UNFPA's 2017 State of World Population Report shows how failure to do so threatens peace and development. This country's growing leadership in this field can play a key role in guaranteeing rights and preventing economic and social crises. Canada is quickly establishing itself as a leader on global leader on sexual and reproductive health and rights, but the work isn't over. We need to ensure such efforts become a part of this country's ethos with a long-term vision that includes accountability and monitoring of impact. we still have a long way to go before the sexual and reproductive rights of all people everywhere are realized. Thank you.
A question here. Michelle Zilio from the Globe and Mail. Dr. Kanem, I understand that Canada will be renewing its $15.6 million annual core funding for the UNFPA. Can you tell me what that funding will be specifically used for in the year to come?
Core funding to Thank you for the question. Core funding to UNFPA supports our work in over 150 countries where we work on the three goals mentioned. First and foremost, to end maternal death, because every day 800 women die in childbirth or in pregnancy-related complications. Core funding allows us to provide training for midwives. It allows us to inform communities directly and also to work with governments on policy issues which will have an effect on reducing maternal mortality. We also, as UNFPA, have a commitment to make sure that unintended pregnancy no longer is a force by the year 2030. UNFPA provides 40% of publicly supplied contraceptive services, including condoms, the pill, injectables, and other forms of methods that are convenient and accessible to women. In some of the poorest communities around the world, UNFPA is the provider of reference. Working with other agencies of the United Nations, we also provide such services in difficult, fragile contexts. For example, in Myanmar, UNFPA was there within 2 days of the exodus that began from Myanmar into Bangladesh. We continue to serve on the front line, shoulder to shoulder with other agencies, to ensure that dignity kits are provided, for example, sanitary supplies and a blanket, a bucket, things that a girl or a mother who is fleeing for her life cannot bring with her, but makes all the difference in these types of contexts. So the ability to surge staff before we attract funding for humanitarian work comes from our core support, and Canada has been a very generous donor to that. And I'll end by saying that our work against gender-based violence, which we include a characterization of child marriage and female genital mutilation as a type of violence, but also family violence, violence in terms of rape as a weapon of war. Our core funding allows us to train and deploy experts who can do things on the prevention side of that equation, but can also help to heal those psychosocial as well as physical wounds that result. So we're really grateful for core funding because it keeps the lights on and it has us at the ready so that we're there before a problem arises, working with governments and with partners. We're there during a crisis, and hopefully we're there afterwards for the rehabilitation efforts.
So will Canadian dollars be specifically used, I'm thinking in the Rohingya crisis in Myanmar or Bangladesh?
The simple answer is yes, because Canada, and apart from the core support, which you have indicated, also gives UNFPA very generous specific funding to go after women and girls issues during a crisis setting. So in that instance, the core support is buttressed by targeted support. I gave the example of being able to have a midwife serve you in the terrible circumstance of being in a refugee camp. The Cuba hurricane, Canada filled that breach and allowed us to be able to provide antenatal care and maternity services, including cesarean sections, even while the lights were out in Cuba. And we use this funding very judiciously because minutes count during times of crisis, but the relationship that you have beforehand, which is what the core support represents, means that the trust is there. So governments do turn to UNFPA to be able to lead on gender-based violence, to be able to help with census and other data gathering exercises. This is the power of being able to strategize appropriately that the Canadian support allows us to do.
Are there any countries where UNFPA has not been able to pursue its activities because of the political situation?
Well, I'm very distressed to mention that only yesterday, UNFPA had to evacuate our international team from the country of Yemen. We are very concerned, and we join our Secretary General, Antonio Guterres, in raising our voice in appealing for hostilities to cease in that country so that not only UNFPA, but the blockade against the city of Sana'a can end so that humanitarian assistance can resume in a country where hunger is rife and where women and girls and the society in general is under threat. So that is one example. There are other instances where the program of UNFPA, which is very vocal and visible on the question of reproductive health and rights, has been questioned or is controversial. And to me, it is lamentable that in certain parts of the world, the question of a girl's right to have comprehensive sexuality education has been either through legal means or through cultural practice been curtailed. We see the effects, and the stark statistic is that the leading cause of death globally among women, girls aged 15 to 19, is childbirth and pregnancy-related complications. So this tells us that protective information would be so important for them to have before they become an adult. And so we continue to advocate for the importance of making sure that age-appropriate but very important biological as well as social information for girls and boys is provided in a timely fashion. Thank you.
Just another question on Canadian funding that is being provided to the UNFPA under this government. Has any of it, to your knowledge, been used to provide abortion services?
UNFPA does not provide abortion services, and Canadian funds are not used for this purpose, nor are any other donor funds used for that purpose.
That goes through other agencies, third parties?
The executive board of UNFPA, which is the member states that guide our work, have been very clear in terms of the parameters of the work of UNFPA, in terms of being one of the leading agencies worldwide in preventing the need for abortion through our contraceptive services, as mentioned. We lead in providing more than 40% of contraceptive commodities worldwide. And to allow women to control their fertility, to make the decision about when, with whom, and how often they wish to make babies, that is one of the most important preventive actions that we can take to end unsafe abortion. Furthermore, our member states have said that for post-abortion care, UNFPA and other agencies as well provide life-saving care to women who are at risk, whose lives are at risk post-abortion. On the question of training or providing for abortion, UNFPA does not do either of those things.